down, and then forward flexion. So bring it all the way up. Any pain with that? Then just strength testing. So I like bring the arms tight to the side like this, and I want you to push out against me. Good. And then I want you to push in. Good. And so some people argue that when you're doing cuff strength testing, kind of you're testing each individual muscle, but really the cuff is all working together, so it's hard to just specifically isolate one. So internal rotation, what would we be looking at there? Subscap, external rotation, infraspinatus and teres minor, right? So then thumbs out, thumbs down, don't let me push down. Good. What are we looking there? Supraspinatus, right? Then you can put that arm down. You can do two different things. So one is just a belly test. So you're going to have them have their elbow out like this and then just push down on their belly, see if that bothers them. Same thing, you can do a lift-off test where you have them push out against you. So, and that's more just, if you think about it, internal rotation, so it's just furthering your internal rotation, so you're testing there. So that's what I'll do just for testing of rotator cuff testing. A lot of times the shoulder's very vague, like they're gonna say, oh, well, it just kind of hurts all over. So make sure you wanna test the neck, so go ahead and touch your ear to this side, touch your ear to that side, any pain with that. Then just palpate along, pericervical spine, see if that's tender at all. Definitely make sure you come out all the way across the clavicle and then feel over that AC joint. A lot of times people come in with these crazy injuries and it's just an AC sprain, so make sure you get right over top of the AC joint, and you want to be very firm and direct, like, is that the pain that you're having? Because people with shoulder pain will complain all over, but you want to know, is that the spot? So get right on that AC joint and see if that's the spot that's giving them pain. And some of the special tests, what I do, so O'Brien's test, what you have to think about is you've got the long head of the biceps running up the arm, attaching to the superior part of the glenoid So when your thumb is pointing down, you're putting the maximal stretch on that long head of the bicep, okay? So resist me pushing down, and remember, thumb down is bad, okay? So pain with your thumb down compared to pain with your thumb up is a positive O'Brien's. If they have pain with both, that may be indicative of labral tear or biceps injury, but that's not a positive O'Brien's in my book. A positive O'Brien's is pain with thumb down, no pain with thumbs up. Now, I'm not saying there's nothing wrong if they have pain with both, but that's not the way the book has written for O'Brien's test. If you're looking specifically at that AC joint, what the next thing you want to do is cross-body abduction. So you want to let me passively do it. You want to bring passive cross-body abduction, and if that gives them pain, usually there's only really one major thing there, the AC joint. Now, in adults, they can also have, a lot of people do push-ups and a lot of bench press. Distal clavicular osteolysis is basically osteoarthritis of the distal tip of the clavicle. I do, for my speeds test, I do hand straight out, forward flexion, push up against resistance. I think that's a good look at long head of the biceps. When you're looking at subacromial impingement, I do two different things. So coming up near the ear, let me do it passively. That's Neer's test. And then for Hawking's impingement, somehow some people have it where they kind of like do like this across. I really don't do that. I say get your arm up, 90 degrees of forward flexion, 90 degrees of flexion at the elbow, and then don't let me push down here. That's the one, when they do that, they kind of shrink down, like, because you're basically pushing the humeral head up into the supraspinatus. So that's what I'll do for subacromial impingement. What else? Also just looking at the scapula, okay? So doing that same range of motion, you're gonna watch, can you bring your hair around the front there? Perfect. So then just slowly bring your arms up to the side. Yeah, to the side, yeah. And then bring them up, and then I want you to just drop them down slowly. And then here you're just looking to see, are the scapulas moving synchronously? Does she have scapular dyskinesis? Is one scapula winging up a little bit? So you may do that, and then sometimes what you can do is push-ups against the wall, push-ups, let them fatigue a little bit, and then see if that's bothering. If you can see some scapular dyskinesis or you can see some winging, then what you'll do is give them a scapular assist. So you'll push that scapula down against the back, have them do their abduction again, and see if that bothers them. So go ahead and do that. It's a little bit hard when you have a female because you can't really push from the front, but you can see that you can give them some help in trying to get that scapula turned out. What you could do, just imagine her laying down. So like if you have an over the head athlete, usually they're gonna have a little bit of increased external rotation, decreased internal rotation, but the arc should be still 180 degrees. So a lot of times you'll have them laying down on the side, you'll rotate them all the way back. Now I'm just gonna relax you so I can get you back further. So let's say we can get her here. What I do is just place my arm down, I see where her 90 degree or her 180 degrees should go, and I should be able to bring her around to that 180 degrees, okay? What happens in an overhead athlete is they can go way back, and then when you bring them, you can maybe get them 150 degrees because of all the constant throwing, the posterior capsule gets tight, you get internal rotation deficit or internal impingement, and so you really want to work on that, the sleeper stretch and the cross body stretch to stretch out that posterior capsule. A lot of times have athletes coming in with shoulder pain, and it's really just because they have a tight posterior capsule. Same thing, imagine if she were to be laying down. What I like to do is hold the arm like this, and then I'm going to try to sublux the humeral head out and in, just to see if that is loose or subluxing, if that's their complaint.
Dr. Hall, can you just do that? Yeah, thanks.
So getting her like this, tucking it under my arm. Now she's laid back, and I'm just trying to push it out posteriorly or push it anteriorly to see if I get a clunk or pop or whatever it may be. So if you have someone that you're like, I'm not really sure, maybe it was a subluxation, maybe it was a dislocation, the apprehension test is just like the apprehension test in the knee. You're not looking for pain, you're looking for apprehension. So what you do is you get them supine, externally rotate them, and you're looking for her face to be like, don't do that, I feel like it's going to come out. Then the relocation is just to give a pressure anteriorly here, give a little bit more stabilization to the shoulder, and she says, oh, the pain went away, or it felt better. Yeah.
You put that pressure before you bring them back, right?
And put that pressure before you bring them back, because the motion of bringing them back is what you're looking for to be positive or negative. Yeah. And so when you do it again, and they're like, oh, that didn't feel the same way. That's I think pretty much. Is there any test or anything that you're right on O'Brien's test? Now, also, just get used to palpating where that long head of the bicep is to be able to say, is that where your pain is coming from? Now, we'll go through it, but a lot of times, if the pain in the thrower is more at the release, then I'm thinking more of a biceps issue. Where if it's more at the, right when they're in their leg cocking phase, then I think a little bit more of a labral issue. The other thing I like is called a dynamic shear test. Now, this is one you might not know. So basically what you're going to do is at flexed, or at 90 degrees at the elbow and at abducted, and basically think about, you got your humeral head here, here's the labral rim, and what I'm doing is trying to run the humeral head along the back part of the labrum there. So I've got you up like this, I'm supporting the back, and I'm running it down and around, and you're looking for like either a pop or pain there. But from the studies that I've read, it's more accurate when you have two that are positive as opposed to just relying on one. But that dynamic shear chest, and you're doing it in plane, so you're not extending them, you're not bringing them forward flexion, you're doing it in plane, and I think that's a good one. If I get that one positive with the right story, that's what I'll